Radiotherapy is the use of mega voltage X-rays, and it's targeted to a specific part in that patient's body where we want to deliver radiotherapy treatment. So a lot of people that have a cancer diagnosis will undergo radiotherapy treatment, and it's like a localized treatment. We can target the specific area that we want to target while trying to minimize dose to anywhere else in the rest of the body.
At the moment in this hospital we treat about 1,800 courses of radiotherapy a year. We treat patients from across North and East Devon. There isn't any radiotherapy provision in North Devon at the moment, so we treat all of those patients here.
We do radical treatment aimed to cure. We also do palliative treatment, which aims to help with the symptoms or pain relief that some people are experiencing. We have 3 treatment rooms for radiotherapy treatment. This is a linear accelerator, or LINAC for short. It's what we use to deliver the radiotherapy treatment.
Surface Guided Radiotherapy uses a set of optical cameras to take a 3D contour of the patient's surface while they're having their treatment. So it helps to set the patient up for treatment because you can use the whole surface and make sure they're in exactly the right position. It then monitors the patient throughout the whole of their treatment. So if they move at all out of the ideal position, then the radiation beam will be stopped until they're back in the correct position. We usually put on some small permanent tattoos which are used to line the patient up. Normally patients would have 3 tattoos which would line them up for treatment, but with SGRT, instead of just having 3 marks, it essentially is using thousands of marks all over their body, so it's even more accurate and quick and easy to set up. A lot of patients have to have immobilization. Again, it's so important that patients are in the correct position and stay in exactly the right position throughout the whole of their treatment. So some of the immobilization that we have to use sometimes is quite restrictive. For example, they might have to have face masks that hold them quite securely down to the bed. With SGRT, because you've got the backup of knowing that if there was any movement, the beam would be stopped, we can begin to look into measures that are slightly more relaxed, maybe open face masks or things that can be a bit more comfortable for the patient.
For patients, it's really nice for them to have that reassurance that they're in the right position, but also as staff, it really helps us know that we are delivering treatment exactly where we want to be treating. At the moment, we're treating a whole range of patients from East to North Devon with radiotherapy, and the treatment they're getting at the moment is completely accurate, but what we want to try and do is improve the patient experience, bring this new technology, so Surface Guided Radiotherapy, into the department to try and enhance patient care, improve it, make it a bit faster, a bit more efficient. It's a tool in our toolbox to help, which hopefully will make their experience a lot better.
SGRT isn't currently funded by the NHS. It is new technology. Many trusts throughout the country have been doing exactly what we're doing right now, fundraising campaigns.
We're looking to raise about £650,000. So this would install the cameras into all 3 of our treatment rooms, so every single patient would be able to benefit. It would also install the cameras into our CT room. So this is used for patients that have got any kind of motion controlled treatment, like if they have to hold their breath or anything that monitors their motion, then we can also use that in CT.
So this isn't about providing a service, this is about enhancing patient care and going over and above what the NHS can currently provide.
A lot of hospitals are starting to get this technology now because it's been recognised how beneficial it can be. For patients, it will hopefully make their radiotherapy experience more comfortable for them. They might be able to avoid having tattoos in the future. They might be able to have less restrictive immobilization. It's reassurance that even if they accidentally had a cough or had to move for some reason, the radiation will be stopped. It will hopefully mean less time on the treatment couch for them because the setup's quicker, the whole process should be more efficient. And it's just that reassurance that we can offer the most accurate radiotherapy possible.
It would be really exciting to be able to have it in the department. If anyone is able to donate either a small amount or a large amount, please consider donating to this amazing appeal so we can get this incredible new technology into our department.